Greetings all, this is Yuvashree, a postgraduate from Saveetha College of Physiotherapy, here to present the topic on efficacy of autogenic relaxation technique on salivary cortisol and quality of life in a stress headache subject, a case study. Let's see the introduction. Stress headache is also known as tension type headache. That are the most prevalent type of headaches affects the adults worldwide. These headaches are often associated with prolonged stress, muscular tension, and psychosomatic disturbances. Cortisol is a glucocorticoid hormone that is secreted by the adrenal gland in response to stress, which serves as a reliable biomarker for physiological stress levels. It was said by Fernandez Lopez et al. In the year 2016. Cortisol imbalance causes sensitization of central nervous system, which leads to headache. It was said by Co et al. In the year 2018. ART is also referred as autogenic relaxation technique, a self-regulatory approach that involves repetitive exercises that calms the mind and physical relaxation by focusing on bodily sensation, breath and visualization. It is used for managing anxiety symptoms, psychosomatic disorder, and chronic pain. It was said by Zombok et al. 2003. The present case study explores the efficacy of autogenic relaxation technique in reducing salivary cortisol levels and enhancing the subject's quality of life that are measured by headache impact questionnaire in patients suffering from stress headache. Now let's see about the review of literature. Fernandez Lopez et al. In the year 2018 conducted a study on college students with tension type headache were given a program that included relaxation exercises and posture correction exercises. The study found out that the participants who underwent these programs have shown less headache pain and better quality of life. This technique supports the relaxation techniques for tension type headache. Sear et al. 2016 conducted a meta-analysis, which means they combined the results from many studies on autogenic training for people with tension type headache. They compared it with no treatment or other therapies. The research showed that autogenic training helped to reduce the headache intensity and frequency and also improve the well-being of the patient. Zombok et al. 2003 worked with people who had tension type headache and gave them to perform autogenic training, and there was no control group, but the results still showed people who undergone these exercises shown less anxiety symptoms and had fewer headaches after the intervention. Let's dive into the background of the study. Tension type headache is the most prevalent form of primary headache, affecting approximately one-third of the global population. It is most commonly among working adults, students, healthcare professionals, and individuals who are exposed to chronic stress. When it is compared with male, women are generally affected more and show symptoms of anxiety, depression, muscle tension, and poor sleep quality. The prevalence of this headache has been reported in 64% of people in India and 85% patient have tension type headache. So chronic stress deregulates the HPA axis, which means hypothalamic pituitary axis, and elevates the cortisol level. Autogenic relaxation technique have been shown to reduce the headache frequency and intensity by increasing the relaxation response and reducing the sympathetic arousal and muscle tension. So this technique really aims to normalize the cortisol secretion and promote the muscular relaxation. In ResearchGap, fewer studies have examined that autogenic relaxation technique directly influence physiological stress markers in individuals with tension type headache. Most available research focuses on headache frequency or severity but neglects to access the compensatory outcome like quality of life. So there is a limited single case study evidence that explores personalized response to autogenic relaxation in real world scenarios, especially in stress-induced headache cases. This study aims to address these gaps by evaluating the effect of autogenic relaxation on salivary cortisol and quality of life in a single subject with stress headache. Now let's see the need for the study. This study evaluates the efficacy of autogenic relaxation technique in modulating salivary cortisol in subjects with stress tension type headache. It investigates the subject's quality of life using a validated outcome measure. Let's see those outcome measures detailedly in the upcoming slides. It reinforces the potential of self-regulated, cost-effective therapeutic techniques for managing stress-related somatic conditions with minimal risk and high scalability. This research may serve as a foundation for clinical trials and integrative treatment strategies for these type of headaches. In aims and objective, aim is to find out the efficacy of ART on salivary cortisol and quality of life in subjects with stress headache. In objectives, it is mainly used to evaluate the effect of ART, which is nothing but autogenic relaxation technique, for reducing stress in stress headache subject by using salivary cortisol test. And it is also used to evaluate for improving quality of life in stress headache subject by using headache impact questionnaire. And let's see the case study. A 28-year-old female presented with chief complaints of recurrent dull pressing headache localized to the bilateral temporal and occipital region for past 2 months. These headaches particularly occurred for 4 to 5 days per week, usually in the evening hours. Tightening band-like sensation pain occurred on the head with no symptoms of vomiting, nausea, etc. On examination, bilateral tenderness was noted over temporalis and suboccipital muscles. There was no signs or trigger points of sinus were observed. Now let's dive into methodology. It is a single case study design and the study setup was Saveetha Hospital. The duration for the study was 6 weeks. Autogenic relaxation technique was conducted for 30 minutes, 4 sessions a week. The outcome that I used for the study were salivary cortisol test and headache impact questionnaire, and it is used for pre and post test values were analyzed by these outcome measures. In exercise protocol, it consists of 9 phases. Each phase focuses on breathing techniques, muscular relaxation, blood flow, parasympathetic activity, and so on. So let's see detailedly about these each phases. Settling phase. Subject made to sit in a comfortable position with eyes closed. And breathing is slowly initiated. Breathing phase. Slow, deep diaphragmatic breathing was activated. Heaviness phase focuses on muscular relaxation. Warm phase focuses on blood flow and vasodilatation. Cardiac regulation encourages parasympathetic activity. Respiratory regulation. Breathing becomes automatic and relaxed. Abdominal phase, internal organs are relaxed and reduced cortisol output. Forehead cooling, focuses on cooling of the forehead. Exit phase, gradually return to the normal state by stretching the fingers and toes. So these image representing that the patient performing those autogenic relaxation technique that follows each phases of this protocol. Here comes the outcome measures. I have used headache impact test and salivary cortisol for this study. Let's see detailedly about it. For headache impact test, the goal is to evaluate how the headache affects day-to-day activities and overall well-being. So it is a 6-item survey. The parameters that include are intensity of pain, role playing, social functioning, cognitive abilities, psychological distress, and vitality. An improvement in headache-related quality of life is indicated by a larger decrease in the score. In salivary cortisol test, saliva is collected usually at the morning due to ensure the standardization that follows a diurnal rhythm that is very high in the morning. The subject spits the saliva into a sterile tube or uses cotton swab to collect the saliva. Samples are immediately frozen or refrigerized until the analysis. Then it is used to determine the cortisol concentration and the pre and post test values were analyzed. And these images shows the headache and salivary cortisol test. Here comes the result. The subject shows significant improvement after autogenic relaxation technique. The data collected were analyzed and statistically with pre and post values by using salivary cortisol test and headache impact questionnaire. The bar graph represents that there is a decrease from baseline to the 12th week that is considered as a follow-up. Both shows a statistical significance in the reduction of the scores. Here we observe that the headache and salivary cortisol scores are significantly reduced by following this intervention. Here comes the discussion. Howlov and Jones et al. 2002 conducted the study on progressive muscle relaxation and salivary cortisol in healthy adults. In the control trial, participated relaxation technique shows a significant reduction in salivary cortisol levels compared to the control group showed no changes. This shows similarity involving self-regulation of physiological functions, supporting the theory that mind-body techniques reduce HPA axis activation and cortisol secretion. Kanji et al. 2006 conducted a randomized controlled trial on nursing students using autogenic training and reported decreased anxiety levels and improved coping with academic stress. This study directly addresses the experience that improved in the emotional state and functional quality of life following the autogenic training. Sang et al. 2008 compared mindfulness versus non-mindfulness exercise in people with depression and found that mind-body practices led to a better psychological outcomes and reduction in the somatic symptoms. ART shares similarity with mindfulness practices emphasizing passive awareness and inner focus, both of which may reduce the stress symptoms. Fernandez Lopez et al. In the year 2016 conducted a randomized controlled trial, relaxation and posture correction exercise for university students with tension type headache. The chosen population were young adults who closely resemble my subject. The findings experience a reduction in headache frequency and improvement in quality of life, which highlights the clinical relevance of non-pharmacological therapy in managing the tension type headache. Hence, this case study highlights the impact of autogenic relaxation on reducing stress and improving quality of life in a stress headache subject. Now let's see about the limitation. Larger sample size can be beneficial for a long-term effect. Short follow-up period was carried. It can also be incorporated with control or a placebo group. Here comes the conclusion. The present study shows the efficacy of autogenic relaxation technique on salivary cortisol and quality of life in a stress headache subject. The results have a high potential benefit in managing stress and improving the quality of life in stress headache subjects. So these are my references. These were collected from different sources like PubMed, etc. So yes, thank you for listening to my presentation and thank you for once again for giving me this opportunity.